Hi, my name is Elijah. I am a student of the PA program at Methodist University, and today I will be practicing an oral presentation of a simulated patient case that involves a complete workup. And practicing this skill because it's something that I will be using in the foreseeable future. So let's get started. Okay, hey, how you doing? I'm Elijah. I just saw the patient in room 2, and I'd like to give you an oral report if you have time for it. Cool. So I saw a 56-year-old female who is coming in complaining of 1 week of lower back pain. She believes that she injured her back after reaching down and picking up a heavy box. The pain has been lingering since that incident. She describes her pain as intermittent and with no radiation, located at the lower left lumbar region. She says that her pain is worse with movement, and she experiences some relief with rest and some NSAIDs. She initially rated her pain at a 4 out of 10 and says that it's a 3 out of 10 with NSAIDs. In addition to her back pain, she has some not difficulty, but pain with urination, as well as some increased frequency. And due to her history of previous UTIs, she's kind of concerned for that kind of thing. Other history includes iron deficiency, anemia, and gastric bypass. She is only on iron supplements at this time, no other medications. She has allergy to penicillin. Sorry, my notes just came down. And she has had prior kidney stones, which she has had a lithotripsy for in the past. As far as her family history goes, she has a mother who has pancreatic cancer, who has a father that has diabetes. Social history, she denies any alcohol, tobacco, or illicit drug use. So for my review of symptoms, it's largely unremarkable. She doesn't have any constitutional symptoms of fever, cough, fatigue. Her abdomen is unremarkable. Her musculoskeletal symptoms are her lower back pain, but no issues with range of motion or gait. On physical exam, she has some left parasternal tenderness on palpation, as well as some intermittent muscle spasms. Otherwise, she has no obvious signs of trauma to that region or to her lower extremities. She was negative for a straight leg test bilaterally, and I think that's about it as far as her physical exam goes. So my assessment of this patient is a 56-year-old female complaining of lower paraspinal lumbar back pain, secondary to likely mechanical mechanism of injury. She needs to be worked up for some kind of musculoskeletal pain, but in addition to that, we need to run a urinalysis, which I actually have already done, and found leukocytes present, but no blood or ketones or glucose or protein, so just the white blood cells. So because of those results, I think that we should do a urine culture to see if there's any kind of gram-resistant organisms present. I think also it might be warranted to talk with GU to see if they want to do any kind of imaging, as there is a possibility of some kind of malignancy with the leukocytes being present. And with her mom having a history of it, I don't think it's inappropriate to explore that. Likewise, I am not sure if we should consult neurology. Her straight leg test was negative, but I don't know if there's any kind of more precise means of completely ruling out a lumbar nerve root, like radiculopathy. So, but as far as my plan goes, I'm going to work her up for some musculoskeletal pain until we can get the results of her urine culture back. I would like to prescribe her possibly some NSAIDs, maybe some stronger analgesics. Just depends on your recommendation, as well as advising her to try to get more rest in a position of comfort, using heating pads if necessary. So I think that's my plan as far as it goes now. Obviously, instruct her that if her pain gets worse, if she starts to have any kind of numbness or tingling or just impaired use of her lower extremities, to call 911, get immediate attention. So yeah, that's my plan. All right, so that's my practice. Hopefully I can learn some things from this, and until next time, thanks for watching.